morning everyone. I am Dr. 𝗕𝒐𝒏𝒕𝒎𝒏𝒕, dental surgeon at Patel Hospital. As we all know, Oral and Maxillofacial Surgery Day is celebrated worldwide on 13th February every year. So to discuss about oral and maxillofacial surgery, what is this branch, what are the procedures which come in this branch, we have with us Dr. Ajay Kumar. He is an oral and maxillofacial surgeon and has further done his fellowship training in the facial trauma and head and neck oncology. Welcome, sir.
Good morning.
Just to start with our talk, please tell us in brief what actually is this oral and maxillofacial surgery branch, as it is this term and this terminology is very much new to the people who are listening to us.
Sure. Thank you, Dr. Arpita. Oral and maxillofacial surgery, it is not very new as what we are considering it. It is there since past 20-30 years on. But the thing is, now because of the awareness which we have created and with the amount of subspecialty or super specialties, these things have become much more popular. Now in this modern surgical era, where the scope of subspecialties or awareness about a particular body organ and technical skills which is required to treat those body areas have been improved, in the same way maxillofacial surgery or the maxillofacial fraternity has evolved.
Okay.
As such, this has a basics. See, we have in simple terms to say, this is a bridging between dentistry and surgery or dentistry and medicine.
Sir, what all are the procedures which come under this oral and maxillofacial surgery?
So broadly we can classify it into minor surgical procedures and major surgical procedures. Minor surgical procedures involves such as in simple teeth extractions, open surgical procedures of teeth related, wisdom tooth removals, small cyst excisions, dental implant placements, and into major, when you are talking about, it comes into head and neck cancers, orthognathic surgeries, cosmetic surgeries, craniofacial surgeries, temporomandibular joint disorders, obstructive sleep apneas, and treatment related to those.
So, as the name suggests, surgery. So, whenever we hear this word surgery, everybody thinks of large OTs and undergoing general anesthesias, getting admitted for a few days, expecting a long recovery period. So, how this oral and maxillofacial surgery is different from like other surgeries of the body, or like, is it necessary to undergo general anesthesia for these surgeries?
No, as I initially said there is broadly into two types, like minor surgical procedures and major surgical procedures. Most of the procedures, especially in India, like a country of ours, most of the surgical procedures of minor are being done under local anesthesias. But to answer your question, like we perform most of the procedures under local anesthesia and few under sedations, and which requires extensive surgical dissections and things that will be performed under general anesthesia.
Tentatively, what is the recovery period after oral and maxillofacial surgery?
For any minor surgeries, it roughly ranges between a day to 3 days, and for any major surgical procedures, it ranges between 7 days to about 3 weeks.
Sir, now we would like to know a little bit about all the procedures in brief, so that everybody will be familiar and aware, like how and when to seek the oral and maxillofacial help. So, sir, let's start with a common procedure which is like done every day and in every clinic, the wisdom tooth removal. Okay. So, please tell us why wisdom tooth removal is necessary. Does everybody have to get the wisdom tooth removed, or for every wisdom tooth is it necessary to seek oral and maxillofacial surgeon's help?
Cut your question into a few parts, like, is wisdom tooth removal a necessity? See, every wisdom tooth need not to be removed. Okay, but there are few indications, as any surgical procedure has few indications, especially wisdom tooth also has it. So if you are considering it, we can broadly classify it into three types, like any infection or infection with some sort of discomfort which becomes an acute necessity to get it out, and only an infection without any symptoms, so that becomes not an emergency or urgency procedure, but it requires some sort of intervention at a later date, or some non-infectious indications, for example like orthognathic surgeries or prosthetic rehabilitations. Those are, if you are coming for any infective and symptomatic etiology, such as most commonly patient comes to us with some sort of infections into the wisdom tooth and related pus discharge or mobility of those things surrounding structures, so that becomes an absolute necessity. And the other indications are pericoronitis, any tooth which is involving with the cyst or the tumors associated with those regions, and other not an emergency but which requires an intervention at a later date are periodontitis, decay, carious teeth, and the teeth which are causing decay to the adjacent tooth. So these becomes indications for wisdom tooth removal.
So how wisdom tooth removal is different from the regular extractions? Like,
see, first of all, the thing is the position of the tooth, which is always very posteriorly located. The accessibility of that region tooth is always an hindrance to everyone, and most of the times, because as we have evolved, the jaw sizes have been decreased, so the space which is required to accommodate this tooth has also reduced. So these type of things where the tooth is in an awkward position, it requires either splitting the tooth into number of pieces or drilling the adjacent bone to make sure that the tooth is being removed. In these terms, the wisdom tooth removal becomes a challenge.
one more thing I want to ask you, that nowadays dental implant is a term which is very much like familiar to everyone. So please let us know what is dental implant, where it is indicated, how long is the surgical procedure, where it is carried out.
See, again, dental implants, yes, dental implants are there since past 50 years or so, but now recent innovations or awareness and the number of materials which has come down into the market has made it much more simpler for the procedure wise, and the cost wise also it has become more economical. That is the reason it is becoming more awareness as of now. Generally, tooth has a root which has been embedded into the jaws. If the tooth has been missing, or because it has been extracted, or because of the fractures, or because of the tumors, if it has been removed, how do we replace this to make sure that the patient has a good function, that is mastication or chewing? So what we do is, we, with the help of a titanium screw, we place this titanium screws into the jaw bones, make sure that these titanium screws get integrated or get fused with the adjacent bone, and with the help of this screw we lay the overlining tooth structures.
So what is the success rate of dental implants? Like, is there any cases you have seen of body rejecting the implant, or does implant also fail?
Yes, implant do fail. Any foreign body, see, all materials body doesn't accept that easily. There will be always foreign body reactions, which we call it as. So, but what we have seen over in years is titanium is one metal which body tends to accept it well when compared to other materials. Generally, on an average, in a healthy individual, dental implant success ranges between about 95 to about 98%, close to.
One more question, doctor. Like, nowadays we get to know that every third or fourth individual is suffering from arthritis. So is there any arthritis related to our jaw joint?
Thank you for asking us this question. See, arthritis, yes, even this was there since before, but people had paid it least attention. Nowadays, because of the advances and because we have also learned or identified what are the etiologies, how to address these things. See, once there is an issue, until and unless you have a solutions for it, it doesn't become popularized. Now we have solutions treating temporomandibular joint disorders, which is the jaw joint, which connects between the base of the skull and the lower jaw, which is most commonly called as temporomandibular joint, and disorders associated with that. We replace the knee joints or in hip joint replacements. Now we are able to replace the temporomandibular joints. So now we have reached to that level. So